Maintaining kidney health is crucial for overall well-being, as these vital organs play a significant role in filtering waste, regulating blood pressure, and producing essential hormones. Here's a comprehensive guide on how to keep your kidneys healthy. 1. Stay hydrated. Importance. Adequate water intake is paramount for kidney function. Water helps the kidneys remove waste products from the blood and prevents the formation of kidney stones. Recommendations. Aim for at least 8 glasses of water per day, but individual needs may vary based on activity level, climate, and overall health. Monitor the color of your urine. Light yellow or clear urine indicates good hydration. Caution. Excessive water intake can also be harmful, particularly for individuals with certain kidney conditions. Consult with a healthcare professional to determine the appropriate amount of water for your specific needs. 2. Maintain a healthy diet. Reduce sodium intake. High sodium intake can elevate blood pressure, putting strain on the kidneys. Limit processed foods, fast food, and restaurant meals, which are often high in sodium. Read food labels carefully and choose low sodium options. 2. Limit processed foods. Processed foods often contain additives, preservatives, and unhealthy fats that can negatively impact kidney health. Focus on whole, unprocessed foods like fruits, vegetables, and lean proteins. Control protein intake. While protein is essential, excessive protein intake can burden the kidneys. Choose lean protein sources like fish, poultry, and beans, and consume them in moderation. Limit phosphorus intake. For individuals with chronic kidney disease, CKD, controlling phosphorus intake is crucial. High phosphorus levels can lead to bone problems and cardiovascular issues. Limit dairy products, processed foods, and dark-colored sodas, which are often high in phosphorus. Potassium management. In later stages of CKD, potassium management is very important. Consult your doctor on what is a safe amount of potassium for you. 3. Control blood pressure. Importance. High blood pressure is a leading cause of kidney damage. Lifestyle changes. Adopt a healthy lifestyle by maintaining a healthy weight, exercising regularly, and following a balanced diet. Medication. If lifestyle changes are insufficient, your doctor may prescribe medication to control blood pressure. Regular monitoring is essential. 4. Manage blood sugar. Importance. Diabetes is another major risk factor for kidney disease. High blood sugar levels can damage the blood vessels in the kidneys. 4. Regular monitoring. If you have diabetes, monitor your blood sugar levels regularly and work with your healthcare provider to keep them within a healthy range. Healthy lifestyle. Maintain a healthy weight, exercise regularly, and follow a diabetic-friendly diet. 5. Maintain a healthy weight. Importance. Obesity increases the risk of developing kidney disease, diabetes, and high blood pressure. Balanced diet and exercise. Combine a balanced diet with regular physical activity to achieve and maintain a healthy weight. Aim for at least 150 minutes of moderate intensity exercise per week. 6. Avoid smoking and limit alcohol consumption. Smoking. Smoking damages blood vessels, reducing blood flow to the kidneys and increasing the risk of kidney disease. Alcohol. Excessive alcohol consumption can also damage the kidneys. Limit alcohol intake or avoid it altogether. 7. Be cautious with over-the-counter medications. NSAIDs. Nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and naproxen can damage the kidneys if taken regularly or in high doses. Use them sparingly and only as directed by your doctor. Other medications. Some other medications can also affect kidney function. Consult with your doctor or pharmacist about any potential risks. 8. Get regular checkups. Kidney function tests. Regular checkups with your doctor are essential, especially if you have risk factors for kidney disease, such as diabetes, high blood pressure, or a family history of kidney 5 disease. Blood and urine tests can assess kidney function. Early detection. Early detection of kidney problems can help prevent further damage and improve outcomes. 9. Exercise regularly. Benefits. Regular physical activity helps control blood pressure, maintain a healthy weight, and improve overall health, all of which are beneficial for kidney health. Variety. Choose activities you enjoy, such as walking, swimming, or cycling, and aim for at least 30 minutes of moderate intensity exercise most days of the week. 6. 10. Manage stress. Impact. Chronic stress can negatively impact kidney function. Stress reduction techniques. Practice stress reduction techniques like meditation, yoga, or deep breathing exercises. 11. Herbal supplements. Caution. Some herbal supplements can be harmful to the kidneys. Consult with your doctor before taking any herbal supplements, especially if you have kidney disease. 12. Limit exposure to nephrotoxins. Nephrotoxins. Certain chemicals and toxins can damage the kidneys. Limit exposure to heavy metals, industrial solvents, and pesticides. 13. Understand your family history. Genetic conditions. Some kidney diseases are hereditary, like polycystic kidney disease. Understanding your family history can help you understand your risk. By adopting these healthy habits, you can significantly reduce your risk of developing kidney disease and maintain optimal kidney function. Remember, early detection and prevention are key to protecting your kidney health. Always consult with a healthcare professional for personalized advice and treatment.